There are parts of our community that don't have the opportunity to fully understand and realize their health potential.
This is an opportunity for a hospital system to really say, we want to meet community where they are and develop change and new solutions.
We know that so much of a person's health is impacted by their environment.
It's determined by where they live, where they pray, where they eat.
So community impact, when it started, our vision was about partnerships.
How can we have communities, through their own investments and existing resources, build and design solutions that can overcome some of these challenges? The programs that are coming out, that these collaborative efforts are really honing in on, are focused on building a community of wellness.
If you want to see where the suffering is, ride down this street and from end to end. And this is where people go who need help. We have free clothing, free food, and we have free counseling. We're here for all the people who need assistance, who need someone to at least shine a light on a path, any path, that's better than where they are. When they know that they've got someone who will help them, aid them with their food, their clothing, that opens them up to another world. Our client load has quadrupled. We serve 4 times the amount of clients that we used to. Thanks to Texas Health Resources, we're mobile. We take the food, the clothing. We take our mental health and physical health and wellness counselors out into the neighborhood. When people come to us, especially at the events, and say, I didn't think that anyone cared enough about me, my neighborhood, my kids enough to bring this to us. That's the one thing that really brings me to tears. They say, if I'm important enough for all of these institutions to come to me in my neighborhood, not shame me, not talk about my situation, just meet me where I am, love me for who I am. It gives them back that feeling that, I am someone.
One in 10 kids will be sexually abused before their 18th birthday. Only 1 in 10 of those will ever tell, which means that most people will go to their grave having never told anyone. Over the years, we've realized that the health outcomes of kids who've had child abuse are some of the very worst. It actually shortens their lifespan. So it's a very significant problem for our entire community when something bad happens to a child early on. The Children's Advocacy Center for North Texas is a mid-sized nonprofit that coordinates the investigation and prosecution of severe child abuse cases. In addition to that justice side, we also provide the healing side to victims.
Abuse, in a lot of ways, in the various forms, is systemic. If you grow up in that, then you are very much at risk of not knowing that this is abnormal, that abuse, be it physically, mentally, psychologically, is not okay. And we hope to, through education, through community outreach, through the different programs that are offered through Children's Advocacy Center, and this group can do some outreach programs, can connect with those folks and help break that cycle. From the law enforcement aspect, it's a big deal, and you can't undersell the involvement of Texas Health in bringing this advocacy center here. It's just been amazing for our county.
Nothing happened in the 10 years of thinking about it, dreaming about it, wishing for it. This money came along and all of a sudden, boom, it happened. If we would have just chipped away at it, it never would have been built. So that big lead gift was game-changing. It was a legacy gift for a community.
Yo nunca había sabido decir te quiero.
I had never known how to say I love you.
Venía de una familia con mucha violencia.
I came from a family with a lot of violence.
Yo no sabía que estaba
I did not
repitiendo
know that I was
patrones.
repeating the same pattern.
Y aquí los vine a reconocer.
And here I was able to identify them.
Me he identificado con
I've been able to
personas
identify with
que
people
muchas veces pasan
who a lot of the
similar lo
times
que yo
go
estoy
through very
pasando.
similar things. I learned how to take in a lot of things and how to process them and how to be able to connect not only with myself, my parent, but with my peers, and that it was okay to communicate.
Cuando nos relacionamos con personas en otros lugares, dicen,
When
es
we
una niña
have other experiences with other people in other
fantástica.
places, they say, oh, your daughter's fantastic
porque es amorosa,
because she's very loving,
es muy especial
she's very special,
y siempre es servicial.
and she's always serving other people. I struggled a lot mentally. A couple years back, I was the opposite of what she was saying, and hearing people say that that's how they feel about me and that's how she feels about me, it makes me very proud that I've overcome these things and that she's been there with me.
Brother Bill's Helping Hand is a wraparound service nonprofit. We take care of those basic needs: food, health care, mental health care, diapers, formula, school supplies, all of those tangible one-off needs. So we try to meet people exactly where they are and realize that when people walk in here, regardless of their situation, we're going to treat them with honor and dignity. Taking care of one's mental health is paramount into taking care of everything else. Your physical health and your mental health are tied inextricably together. And so here at Brother Bill's, when someone walks in the building, they need that help, we have counselors on site to help serve those needs.
If trauma and anxiety are not addressed, job training can't be as effective because neighbors need to be able to be confident to deal with their anxiety going to a job interview even. 5 days a week, we have therapists here at Brother Bill's working alongside Brother Bill's and caring for the neighbors of West Dallas. By collaborating with Texas Health Resources and co-locating, we are destigmatizing mental health care because we are visible. We are located at an organization that is already trusted in the community. Children and adults are very resilient and they have the ability to heal. We just need to come alongside them.
We believe that they'll find a way that their lives are enriched in this beautiful and powerful way, and they don't need the services anymore. We've empowered them to unlock their God-given potential to be who they're supposed to be.
You get told no enough times, what happens to these multi-generational families? They just stop trying.
It's a ripple, but it's a ripple that's going to have an effect that generational poverty is going to end.
All it takes is that one person to break that cycle. It breaks it for everyone in that family.
We're making an impact, but that impact takes time.
We really have to be investing long-term because the changes we're talking about are, a full generation, maybe even 2 generations, maybe 3.
THR has been a leader in reaching into communities that are suffering from poverty and looking at the root causes of why things are the way they are.
I did not know that they would be this connected to individuals in these marginal neighborhoods, that they would even have that desire to do that for our communities.
Texas Health Resources has a passion that is applied and is practical.
We know it's made a difference here in West Dallas. We know it's made a difference in all the other little surrounding communities that they have been impacting.
Having the programs and the focus that Texas Health does is truly advancing our mission.
I could not have imagined all this. Could not have.
We believe that small drop in the pond will reverberate throughout all generations.